We realize at Norton Healthcare that respiratory therapy is very important and that there are not enough of them for the future. And so we are focused and devoted to helping grow our own through the Respiratory Therapy Apprentice program.
I wanted to get into healthcare because my mom is a nurse and I knew that she was helping people and I wanted to help people too.
The Respiratory Therapy Apprentice program at Norton Healthcare is an 18 to 24 month program that requires you to be in college pursuing a career in respiratory therapy. It really focuses on helping students to understand really what Norton Healthcare has to offer for respiratory therapy, all the different places a respiratory therapist can work for Norton Healthcare, and gets them some more hands-on experience when it comes to the different equipment that we work with in respiratory. The Explore phase is 32 hours of observation, and it is intended to get the student to observe at the different Norton Healthcare facilities so they can kind of learn different patient populations that respiratory therapists care for, and it helps them to kind of learn to choose a pathway that they might be interested in when it comes to pediatrics or adults or a mixed population.
I've learned the different kinds of roles respiratory therapists can play, the different kinds of things respiratory therapists do.
They also get to see how a respiratory therapist works in transport and goes on the helicopter and in the ambulance. They can visit the sleep lab and pulmonary rehab, watch an advanced therapist place PICC lines and mid-lines in the IV team, and work in the pulmonary function lab.
You're able to learn more hands-on and kind of figure out what you're doing at school.
There's so many different opportunities, and Norton Healthcare really does their best to try to utilize respiratory therapists in every way they can.
Before I started this job in college, I was worried about being able to handle both of them, but it's really flexible. I am able to come in after school. I'm not at a set range of hours, which makes it really easy to juggle school and work. When I come to work, I'm also learning what I'm learning in school.
After they finish their Explorer hours, they are able to apply for the apprentice tier of the program, where they choose a facility in Norton Healthcare that they will then be stationed at to work as an apprentice. And as an apprentice, they're able to do small tasks like cleaning ventilators and other respiratory equipment. They help with oxygen tank management. They can do EKGs for patients, and also help with assisting transportation of respiratory patients as well.
One of my favorite things I've been able to do is learning how to clean the vents, put them together, and also being able to do the Explore program, being able to shadow and figure out where I want to go and kind of experience what being an RT is like.
The respiratory apprentices being able to help with smaller tasks like oxygen tank management helps to relieve the licensed therapists to be able to focus more of their time on taking care of their patients and staying at the bedside longer. So Norton Healthcare and the Center for Allied Health Education help the apprentices move to their student practitioner license positions by working with the departments to ensure that there are positions for them to move into after Tier 2, the program, as well as we bring them into the classroom and teach them the skills to help them transition more smoothly from an apprentice into a student position, which actually lets them work at the bedside with patients.
I hope to one day become an advanced respiratory therapist for Norton Healthcare.